Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing health care to the residents of the Washington Township Healthcare District for the past 60 years. Today's presenter is Dr. Jeanie Ahn. Dr. Ahn is a nephrology specialist with Washington Hospital.
Imagine you're one of 30 million Americans that have been diagnosed with chronic kidney disease. You are trying to live a healthy lifestyle. You eat kale salads, you try to avoid potato chips, you go to the gym once a week, okay, maybe once a month, and one day your physician says to you, Mr. Smith, one of your labs is out of range. Your serum creatinine is high, which means you may have kidney disease, and I'm going to send you to see a nephrologist. If you're like most people, you have a lot of questions at this point. You want to know, how can I be sick if I don't have any pain? Should I be drinking more water? Is chronic kidney disease treatable? What will a nephrologist do for me? So today, I'm going to give you the answer to these questions. So let's start with what the kidneys are. Your kidneys are major organs of the body. Most people have two, one for you and one to share with a friend. Each one is about the size of a closed fist, located in your upper back, protected by your lower ribs, and they're connected by ureters, which are tubes that connect your kidneys to the bladder, and then the urine that it makes exits the body. So what do the kidneys do? Why are they important to us? The kidney has actually a lot of functions. It removes waste products from your body. It regulates the sodium and water content of your body. And it also is a hormone factory that makes a bunch of hormones to help regulate your blood pressure, help you to make blood, and also absorb calcium from your food so that you can keep your bones healthy. If you have an unhealthy kidney, you'll have the problems of volume overload, elevated waste products such as urea, creatinine, and potassium, and changes in hormone levels. So you can have high blood pressure, you can become anemic because you're not making enough red cells, and develop bone disease. So what's the definition of chronic kidney disease? When somebody says you have chronic kidney disease, what does that mean? Chronic kidney disease is defined as the gradual, usually permanent loss of kidney function over time. So your kidneys don't regenerate, and the loss of function that you get over time represents normal tissue being replaced by fibrosis and scarring. So this is not possible to restore. Chronic kidney disease can lead to kidney failure, which is near total or total loss of kidney function. It's divided into 5 stages of increasing severity. So the table generally looks like this. You have stages 1 through 5 with the numbers representing the percentage of function that you have. But I found a better slide for you to represent the stages of CKD, and it looks like this. So that's your glomeruli. Those are your filtering units. You can see this one in stage 1 is very happy. You have normal kidney function, but you have some signs of kidney disease, such as protein in the urine. Stage 2 is mild renal insufficiency with kidney function between 60 and 90%. Stage 3 is where most patients are. This is moderate renal dysfunction with kidney function between 30 and 60%. Most of the patients I meet in my office are at stage 3. Stage 4 is severe renal insufficiency, where your kidney function is 15 to 30%. At that time, you start to see some of the complications or side effects of low kidney function, and we start talking about what to do if you continue to lose function and go on to stage 5, which is kidney failure. So you see your glomeruli has been replaced with a robot. This represents going on dialysis or getting a transplant. At stage 5 chronic kidney disease, your kidneys are not working enough to keep you healthy. Okay, So this is a complicated slide showing the pathogenesis of chronic renal failure. I want you to study these pathways carefully, write them down if you have to, and memorize them. There's going to be a quiz at the end of the talk, and the winner is going to get a prize. Okay, I'm just kidding. There's no prize. Okay, so I will tell you, though, in a different way, what causes kidney disease. So this is data from the US Renal Data System from 2015. It shows that 46% of patients that go on to end-stage kidney disease do so from diabetes. The next common cause is hypertension. It's also known as high blood pressure. Third is glomerulonephritis, and I'll talk a little more about that later on. Cystic disease comprises 2% of all cases, and other is 17%. So other includes congenital diseases, urinary obstruction, repeated urinary infections, drugs and toxins, and congenital diseases. So the most common cause of chronic kidney disease is diabetes. So diabetes mellitus is a disease that results in high blood sugar. Too much glucose in the blood for a long time can cause severe problems, including damage to the small blood vessels in the body. In type 1 diabetes, the pancreas doesn't make enough insulin, and you need insulin injections. In type 2 diabetes, the pancreas makes enough insulin, but the body doesn't use it properly. Diabetes is one of the most common causes of chronic kidney disease, but not all diabetics get chronic kidney disease. About 20 to 30% of patients develop chronic kidney disease. Hypertension, high blood pressure, which is often occurs together with diabetes, adds additional stress to the kidney. The effects of diabetes on the kidney can be reduced by intensive blood sugar control and reduction of blood pressure. If you have high blood pressure, treatment with medications such as an ACE inhibitor or ARB, those are types of blood pressure medications, has been shown to delay the progression of kidney disease. There's also a recent study that shows that Trulicity offered a benefit to patient diabetics that are on it in that it provided a slower decline in kidney function and a greater reduction in urine protein. The second most common cause is hypertension. So hypertension, which is another word for high blood pressure, happens when the force of blood against your artery walls increase. It's a common cause of other complications such as heart attacks, enlargement of the heart, and strokes. When your blood pressure is controlled, your risk of complications is decreased. So what you should understand about the relationship between chronic kidney disease and high blood pressure is that kidney disease is both a cause and a consequence of high blood pressure. Controlling your blood pressure will reduce your cardiovascular risk and also risk to your kidneys. Controlling or reducing the protein in your urine also reduces cardiovascular risk and risk to your kidneys. One good question is, what should your blood pressure be? So normal blood pressure is less than 120/80. We are, however, always doing new studies and getting new information. The current recommendations are not always consistent. So these are from several different organizations. The American Heart Association and American College of Cardiology in November 2017 announced that their blood pressure goal was changing, and they now recommend that everybody should aim for a blood pressure of less than 130/80. The American Diabetes Association's goal is less than 140/90 unless you have heart disease, in which case it's less at 130/80. The JNC8, which last met in 2014, recommended that for patients with diabetes or chronic kidney disease, your blood pressure should be less than 140/90. For most of the patients that I see who have established chronic kidney disease, I recommend blood pressure less than 130/80. Glomerulonephritis is the third leading cause of chronic kidney disease. Glomerulonephritis is a disease that causes inflammation of the filtering units of the kidney. Glomerulonephritis can happen suddenly, like after an infection, and can resolve spontaneously. However, it can also develop slowly over many years and cause progressive loss of kidney function. So who's at greatest risk? These are some of the factors that cause chronic kidney disease. If you have diabetes, you're at higher risk. If you have high blood pressure, heart problems, or stroke, if you're overweight, if you have a family history of kidney disease, if you smoke, and if you're over 60 years old. Another risk factor is race. So African Americans, Hispanic Americans, Asian or Pacific Islanders, and American Indians are also at greater risk of developing chronic kidney disease. And so are seniors. So the AARP has a broad definition of senior citizens, but I'm going to define seniors as over 65. So the two key points that I want to show you on the slide, seniors, if you're age 65 or over, you have the highest prevalence of kidney disease. This slide represents prevalence of end-stage kidney disease between the years 2000 and 2015. Not only are seniors in the group with the highest prevalence, but you can see that it's been increasing since 2000. So why do we care? I mean, you're subject to kidney failure, but chronic kidney disease also has implications for your health in that it increases your risk for cardiovascular disease. So your cardiovascular risk increases proportionally as your kidney function falls below 60%. Death from cardiovascular disease is 8 times higher in patients with chronic kidney disease, which is much higher than their risk of death from cancer. And this occurs whether your chronic kidney disease progresses to complete kidney failure or not. What if your kidneys fail? So this is called end-stage renal disease. Your options if your kidneys completely fail are renal replacement therapy, that's dialysis. So you have different types of dialysis, such as hemodialysis, peritoneal dialysis, home dialysis, or another option is to get a kidney transplant, where you get an organ from somebody else, or hospice. So some patients don't want to do either of those options, and they choose not to treat their kidney disease, in which case you'll pass away from your kidney failure because you can't live without your kidneys. So this unfortunate lady sitting in a dialysis chair, and she's surrounded by all of these complications: anemia, infertility, anorexia, nausea. Makes it sound like dialysis is really terrible, but I don't think it's that bad. Okay, so most people with chronic kidney disease don't know it. Chronic kidney disease is silent. Most don't have any symptoms in the early stages. You can lose 90% of your kidney function without experiencing any symptoms. Early detection is the key. So since you don't have any symptoms in the early stages of chronic kidney disease, early detection is a challenge. But the benefit of early detection is that we can slow the progression to kidney failure, and we can reduce the related complications of anemia, bone disease, and malnutrition. So how do we detect chronic kidney disease? So we have 3 simple tests: your blood pressure, your urine albumin or urine protein, and your serum creatinine. This is a screening lab checklist: the urinalysis, comprehensive metabolic panel, complete blood count, and lipid panel. These are tests that your primary care doctor generally orders on a yearly basis that help screen for some of the side effects of low kidney function, and also to see if your creatinine is normal. So how many of you look at your labs? Great, so do my patients. And they come and they ask me, what do these numbers mean? So I'm going to cover some of the more common numbers that we talk about in visits. Serum creatinine. Creatinine is a waste product in your blood that comes from muscle activity. A normal creatinine is less than 1. Estimated glomerular filtration rate. So I just call that GFR. Your GFR tells you how much kidney function you have. It's calculated from your blood level of creatinine. It's a complicated equation that takes into account your age, your sex, and what race you are, and it spits out this magic number that's similar or very close to your percentage of kidney function. A normal eGFR is 110 to 120, which is why I usually tell patients it's about your percentage of function because it's close to 100. Blood urea nitrogen. Urea nitrogen is a normal waste product in your blood. It comes down from the from the breakdown of protein in the foods that you eat and your body metabolism. It generally follows your creatinine, so if your creatinine's a little high, your BUN will be a little high. Potassium. Potassium is a mineral in your blood that helps your heart and muscles work properly. A potassium level that is too high or too low can weaken muscles and change your heartbeat. Phosphorus is a mineral in food that helps build your bones. A high phosphorus level can lead to bone disease. And urine protein. When your kidneys are damaged, protein leaks into your urine. The protein that we see is mostly albumin. So I want to talk to you about sodium. I'm sure a lot of your doctors talk to you about salt. So sodium is a mineral that influences fluid balance and blood pressure. Your kidneys remove excess salt and fluid, and sodium is found in foods naturally or added to processed foods and used as a preservative. Your sodium limit should be around 2,000 milligrams a day. So here's a list of some high and low sodium foods. This is taken from the US FDA labeling guide. You can see here that they consider salt a high sodium food. Also, you can see that regular tomato sauce is on this list. So if you eat a lot of tomato sauce, you may want to consider looking for the reduced sodium tomato sauce. Okay, let's talk about your protein needs. So a question I often get is, how much protein should I be eating? Should I eat less protein? A normal adult has a requirement of about 6 ounces of protein a day. If you're on dialysis or transplant, this will change. So I generally don't ask patients to be on a protein-restricted diet unless they're also seeing a dietitian because of the risk of malnutrition. Instead, I ask them to focus on their portion size. So the recommendations on the amount of protein you should be eating is often much less than what people are generally eating. Serving size is a half a chicken breast, a hamburger patty, or 3 ounces of meat. 3 ounces of meat looks like the palm of your hand. So if you're eating steaks that are much larger than the palm of your hand, you're eating more than 1 serving size. Fluid. Here's a big question. Your kidneys regulate fluid balance. The fluid will build up when your kidney function declines, but it's one of the last things to go. If you have fluid retention, this is called edema or swelling. So fluid is all foods that are liquid at room temperature count. So that includes soup, like the picture. The usual wisdom is 8 cups of 8 ounces of water a day, but it's a little more complicated than that. So your fluid need will vary by your environment, activity, age, and health status. If you are more active, you need more water. If the temperature outside is higher, you'll need more water. If you have conditions like congestive heart failure, you need less water because you should be on a fluid limitation in order to not go into congestive heart failure. So how much water should I drink? It turns out that the US Institute of Medicine has guidelines regarding adequate intake. However, these recommendations are based on observational studies during the National Health and Nutrition Examination Study. So basically what they did is that they monitored how much water a day the participants in the study were drinking. It wasn't done with any scientific measurements of dehydration, so this isn't your minimum water requirement. This is just an observation of how much water most of those people drank. And what they found was that women drank about 2,700 milliliters a day, and men drank 3,700 milliliters a day. Food in the US contains about 22% of your water needs. If you're in Greece, you eat more fruits and vegetables and your food is 29%. But in the US, it's about 22%. I did want to make a remark about aging. Normally I tell people to follow their thirst. However, when you get older, you become less sensitive to your thirst mechanism. So older people drink less and they feel less thirsty. So if you're older, you should maybe make an effort to monitor how much fluid you're taking in to make sure that you don't get too behind. When people ask me about how much water should I drink, I think the question that they're really asking me is this going to help protect my kidneys? And up until recently, I didn't have a good answer. However, in May of 2018, there was a study published in JAMA. I think the title is pretty self-explanatory. It's called Effective Coaching to Increase Water Intake on Kidney Function Decline in Adults with Chronic Kidney Disease. So that's what they studied. The question is, does drinking more water protect against declining kidney function in patients with chronic kidney disease? So people in the hydration group were coached to drink 1/2 to 1.5 liters more than people in the control group. And what we found was that coaching to increase water intake did not significantly slow the decline in kidney function in patients with chronic kidney disease at a 1-year follow-up, which is unfortunate because my job would be so much easier if I could just tell you, drink more water and you'll be fine. But apparently it's not that easy. So should I drink cranberry juice? Cranberry is the berry fruit of a North American evergreen shrub. The active ingredient is that word. Cranberry supplements are mainly used to prevent bladder infections. That's because the active ingredient reduces bacterial adhesion to your bladder cells. So it seems like it makes a lot of sense. Does it work though? So in 2016, they did a study in nursing home patients. 147 women took 2 capsules daily. That's equivalent to about 20 ounces of cranberry juice. So when they looked at 6 months, they found that, yes, these women had decreased bacteria in their urine, which is great. After a year, though, what they found was that clinically, they had no change in the amount of urinary tract infections that it had. And if you have a urinary tract infection, there's no evidence that cranberry supplements can treat it. So if you have an established bladder infection, don't drink cranberry juice, call your doctor and get a course of antibiotics to clear it up. Another common question, do I have pain because of my kidneys? So people come in, they want to know, is my back pain kidney pain? So I'm going to say that back pain is very common. 75% of all Americans are going to experience back pain in their lifetime. Sometimes the location can give you a clue. Pain from your kidneys is more often on the flank, which is the side of your body, whereas other kinds of back pain are in your back. Most kidney-related pain is due to stones or infections. Here's a list of all the different causes of chronic back pain. Here's a picture of an abnormal looking herniated disc and a normal disc. This is a picture of your lumbar spine. So I'm not going to go through all of these. I'm just going to point out that only 2 of these causes are related to your kidneys, kidney stones and pyelonephritis, which is a kidney infection. So I have good news, and that's that chronic kidney disease does not cause back pain. There are no nerve endings in your kidneys. Pain is not a symptom of decreased kidney function. The loss of kidney function is asymptomatic. So here's a picture of what your kidneys would look like if chronic kidney disease made them radioactive. It looks like it hurts, but it does not hurt. So that's good news. How do we treat chronic kidney disease? So if this were the 1900s, I would give you Dr. Chase's kidney and liver pills, and then I would cure your liver at the same time. Unfortunately, the FDA put Dr. Chase out of business, so we have to do much harder things. Identify patients at risk, initiate treatment to slow the progression of chronic kidney disease, anticipate the complications of chronic kidney disease and treat them aggressively, evaluate for comorbid conditions and treat those aggressively, and prepare for the timely initiation of dialysis. Another reasonable question that I often get is, what can I do to slow chronic kidney disease? So, like weight loss, none of these things are easy. You should control your diabetes, control your high blood pressure. So high blood pressure actually has more of an impact on preserving your kidney function than diabetes does. Take certain medications if you have diabetes or hypertension. Stop smoking. Maintain a healthy diet. Exercise and control your weight. Reduce stress. And use over-the-counter medications carefully. The take-home points I have for you are that kidneys are vital organs that clean your blood, balance your chemicals, and produce hormones. Chronic kidney disease can be detected by simple tests. Diabetes and hypertension are the leading causes of chronic kidney disease. Chronic kidney disease will increase your risk of cardiovascular complications such as heart attack and strokes, and talk to your doctor, especially if you're at high risk. So it may seem like mostly bad news if you have chronic kidney disease, but I did want to share some tips with you. Top 10 tips for living well with chronic kidney disease. So learn it and live it. Learn all you can about chronic kidney disease and then live the type of lifestyle that will promote your optimum health and wellness. Have faith in yourself. Having chronic kidney disease is a challenge, but believing in yourself can help you to prevail. Be your own best advocate. Being well informed will help you to lobby and fight for the treatments that are in your best interest. Keep tabs on your test. Because chronic kidney disease is a progressive illness, you must monitor your symptoms, well, probably your lab tests, because you're not going to really have any symptoms, on an ongoing basis, and be up to date on your test results. That way you can match your treatment and lifestyle options with your symptoms and stages. Be proactive and take control. If you're considering a transplant, conduct research and contact a transplant center. In addition, follow your doctor's recommendations along the way. Develop strong relationships. Take time to build a connection with all the members of your health team. This will help you to have in-depth conversations and ask tough questions. Also, be sure to nurture your personal relationships and have a solid support network of friends and family. Exercise and eat right. In addition to taking your medications or managing a treatment regimen, you must make daily exercise and healthy eating a top priority. Recognize that work is good for you. A lot of times when patients reach dialysis, they want to quit their jobs and stop working. But if you have a job or you spend time volunteering, realize that having an outlet that enables you to feel competent and productive is positive for your total well-being. We have studies that show that dialysis patients who work live longer than the patients who don't. You may need to consider a reduced schedule or part-time work, but continuing your work schedule should help you stay connected and add to your quality of life. Last 2 points, make a plan. Since chronic kidney disease is a chronic health issue, you need a plan that looks ahead, 3, 5, 7 years in the future. Know your treatment options and contemplate which ones will suit you best. Take time to consider what options you want to pursue if your condition worsens or your symptoms change. Make it a priority to enjoy each day. Taking control of your health will enable you to feel your best. Recognize that feeling strong and well is what will allow you to do the activities that you enjoy most. So each day, make sure you take time to do just that. I have a model of a kidney. If you want to see what the inside of the kidney looks like, this is not life-size, this is a little large. Your kidneys are actually like 8 to 10 centimeters in size, so this would be the kidney of a giant. Maybe a cow, okay. So thank you.